Hey guys, it's Danielle with Healthy Kitty Club, and today we're going to be getting into all things pelvic floor issues, therapy, services, treatments with Dr. Lisa Dickinson and Dr. Meghan Bennett with Amber Wellness Group. So let's get into it. Welcome to the first official podcast of Healthy Kitty Club. I am here today with Lisa Dickinson and Meghan Bennett from Amber Wellness Group. Amber Wellness Group is actually the first clinic that I looked into when I started thinking about doing this podcast. It was the first website that I really took a huge deep dive into everything that you guys offer, all of the symptoms, the treatments, so many things that I had no clue about, so many things that I struggle with myself, that friends and family that I know of struggle with, that really made me realize just how many conversations we're not having about these problems. So I think it's pretty cool that you guys are my first guests, because I feel like you guys are kind of where it all started for me, honestly. So thank you for being here.
Gonna make me cry.
Thanks for having us. It's the truth. It was like, oh my gosh, there's so much information, and this is I was just like so inspired to get this out to everybody that I can. So, and I know you said this is your year of yeses. And so I'm really grateful that I got the yes for sure. So, Lisa, Meghan, why don't you introduce yourselves? Tell us a little bit about yourselves and what inspired you to get into this field, because it's a pretty cool one.
Yeah, thank you so much for reaching out. It's a pleasure for us to be here. So I'm Dr. Lisa Dickinson, and I'm the owner and a physician, a naturopathic physician at Amber Wellness Group. Um, yeah, just, all the years of women's health care that just doesn't seem to meet us where we are needed to be met and getting the care that we need. It seems like, over the years, even in my own history, I just never felt really seen when I was getting a simple annual exam, or I never really felt empowered to ask for what I needed, or maybe felt a little ashamed, or of what was going on in my pelvic bowl. Really hard to talk about any of that, and it's not hard to talk about if somebody opens the door. And I really wanted to create a practice, and then it rolled into a community of practitioners and amazing female practitioners we have at Amber Wellness Group, to create a safe space for women and to empower them and to help them advocate for the care that they need.
So good. So good.
Yeah. I'm Meghan Bennett, also a naturopathic physician at Amber Wellness Group, and have been working with Dr. Lisa for almost 8 years now.
Awesome.
Inspired to get into naturopathic medicine just through some of my own health issues, and really similar, like just getting to a crisis point and not having any prevention before that, or any guidance about my own body and what was happening and how I got there. And it just led to emergency situations. And I think we all would rather not go that route.
Absolutely.
And what I love about naturopathic medicine is we really are always trying to get to whatever that root cause is of the imbalance in your body. We try and listen to what your body is telling us. And I think of it like putting together a puzzle or digging in, and we get to just really kind of unravel. And in that process, we get to empower people. Like, it's not all in your head. You're not just making it up. Like, there is legitimately something happening, even if we don't have a lab or a test saying this is what it is.
Huge. Well, and I feel like so many times we assume that what we're going through, not to say that it's normal, but it's just, as women, I feel like so many of us just figure, oh, well, it's just part of being a woman. Because we know that there are so many things that we struggle with that are painful, that are irritating, that can go from 0 to 60. And it's like I feel like in our culture, we just are primed to be like, it's fine. It's fine. I don't need to talk about it. We don't need to have a conversation because everybody pees a little when they laugh. What do you mean?
Right.
Like, what's the
Right.
big deal? Like, why do I need to have a conversation or try to fix it? Because it's like the norm. And
Yep.
that was one thing, when I started looking into this, it was like, this is not normal. And not that it's not normal, but it's like, this isn't something you just have to accept and be
Right.
okay
Right.
with. There are things that you can do to help that. Like, and it just amazes me that these are conversations we're not having. I mean, myself, I've had 2 kids. Both of them were almost 10 pounds. And it amazes me that no one ever said to me anything about the pelvic bowl, anything about what could happen
Right.
when you have just given birth to a bowling ball
Right.
and what could have been done years and years ago that I'm just now trying to catch up on.
Yeah.
So with your
Yeah.
clinic, what kind of services and treatments do you guys offer there?
We offer so many different services for just health in general, but focusing specifically on the pelvic floor. We offer 2 different types of pelvic floor therapy. One really focuses in more on trigger point, finding muscular imbalance and helping to relieve that. Kind of like when you have a trigger point in your shoulders, you need to move that. And we know that it hurts and it can be painful. Well, we have an amazing amount of muscles in our pelvic bowl that create stability as well as can block circulation when it gets tight. When you get your shoulder rubbed and you get blood flow going back there. Yeah. So anyway, that's one type of pelvic floor, and we can talk therapy, and we can talk more about that. And then I'll let Dr. Meghan talk about holistic pelvic care.
Yeah, holistic pelvic care is the type that I offer. I was trained with Tammy Kent, who's also a Portlander, and she puts together tools that help with the mind-body connection, which I think is huge, especially if we've had pain or trauma or difficult birth or difficult pregnancy or something that's kind of caused us to disconnect from that part of the body. If we can rebuild and rewire that connection and really start to get back into that part of the body, we then can bring in circulation to those tissues, and we can release things like trigger points, and then we just become aware that, oh, I might need to go to the bathroom. I shouldn't hold this and maybe leak when I laugh, or, just becoming more aware of that part of the body.
And when you can be aware, your immune surveillance can come back there. So people with chronic bacterial vaginosis or chronic yeast infection or any sort of pelvic infection that they have, you bring blood flow, whether it's through the breath or releasing trigger points, we create more circulation.
Oh, that's wild.
Yeah, it's yeah. And so when we disconnect, I
was like, wait, what?
You just have
I just need to breathe more.
Well, and recognizing breath into the pelvic bowl is really it's really powerful.
Yeah, that's amazing.
So we do those types of therapies, and we'll get more into that, I'm sure, in a moment. But then we also for the pelvic bowl, we'll also prescribe hormones if that's indicated for somebody. Somebody might have some vaginal atrophy and they need, from lower estrogen levels. And estrogen really does create the collagen and the integrity and the elasticity of the pelvic bowl that not only do we need for non-painful intercourse, but also for bacteria, good bacteria in the microbiome of the pelvic bowl. So, estrogen is important, but sometimes we don't want estrogen, right? If we have a cancer diagnosis or we have, have recovered from a cancer diagnosis, maybe we don't want that. And so it was about 7 years ago, we brought in 2 different devices that are non-hormonal that help to build collagen in the pelvic floor. We're the only clinic in Portland still, I think, that has both of these devices. It's a Thermiva that does radio frequency warming to the tissue to help build the collagen. And then the MLT, which is a laser that also does intentionally create some changes in the mucosa of the vagina to help repair and create collagen. So we have some amazing tools
So
that we
good.
can provide for women.
Well, yeah, and
even
options that are
options.
just like outside of the box.
Yeah.
Well, and sometimes estrogen is great for a little bit, but you might get even more benefit if you combine them.
Right.
And we've really, like we took a real deep dive with these pelvic floor laser and radio frequency devices, and there's a standard of care of what you have to do and when you need to do it. And when we add that to HPC, holistic pelvic care, or pelvic floor therapy, trigger point works better.
Yeah.
And then guess what? You're aware of your pelvic bowl and you're friends with your pelvic bowl again.
Full circle happiness.
And we can create intimacy again with ourselves or with our partners, and not have pain, which then pain makes us go away.
Yeah,
right? We don't
absolutely.
want to engage with something when it's painful.
Oh my gosh, so many resources.
So there's, we could keep talking.
Well, that's what we're here for. So, okay. Meghan is going to do a 5-minute guided meditation with us. So tell us a little bit about it, how it works, why you do it, and then we'll...
So as I kind of referenced, like just bringing in that mind-body connection is huge, but also if we think about this is where our energetically, like our root chakra is. So this should be where we feel really solid and grounded in the body. And so if we can take a moment and really kind of bring our focus down, feel kind of that rooted groundedness in our seat, then we can create some of that blood flow, circulation, awareness. And we're kind of getting out of that headspace a little bit too, where I think we all like to hang out sometimes.
Absolutely, most of the time.
Most of the time.
Yeah. It's like the running log of all of the things I need to do, I didn't do, I should do, dinner, carpool, everything.
Always. Yeah, and it's really helpful to take a little break from that record and work that part of the, like spiritual muscle, like that energetic muscle of being in your body and being aware of your body, but not kind of thinking about all the things.
So good. So good. Yay. Well, okay. So what do I need to do? What do we need to do?
Just get in a comfortable seat.
Okay.
And there we go. Okay. And then we'll just kind of softly close eyes if you feel comfortable with that. And first, we're just going to start with taking a few deep breaths. And doing belly breath, just letting your belly fill up with air. And we're just going to breathe in relaxation and breathe out any tension or stress. And as you're doing that, starting to feel your pelvis and your sits bones and where you're connecting with your seat. And you can start to even imagine that root coming out from your sacrum and grounding you into the earth. If you want, you can put a hand over your lower belly or pelvis. And again, just releasing anything that might be bringing your awareness, if it's discomfort or temperature or tension. And just trying to send that down your root into the ground. maybe even noticing if there is a place that you have discomfort, if you can focus on that spot. I think sometimes we use a lot of energy to not feel a discomfort. And so just taking a moment to just sit with it for a second and see if you can bring the breath into that spot. It can be helpful to visualize your breath as a color or a liquid, wind kind of coming in and just moving things through. And seeing if you can let that expand and really start to fill up your lower belly. And starting to feel that connection just from the pelvis to the belly. And you can even take a hand and put that on the belly. And then I always like to also bring in that heart chakra, that heart energy. So you can bring a hand up over your heart and see if you can feel that connection between your heart hand and your pelvic or belly hand. How often do we let ourselves do this, right? Like turn off tape and just sit with your breath and your body and check in and connect. And then from that heart center, we can bring in something that we want to hold space for. If that's something we're working on, something we're planning, something we'd like to move into, whether that's, more peace or better sleep or hormone balance, whatever, but just holding space within this energetic kind of power center of our root. And giving some energy to that intention. And that's something you can kind of check in on throughout the week and see how that feels and what that looks like. But just carving out a little space for what you want to manifest and bring into your life. And then we'll do 2 more deep breaths. And with that, just picturing blessing and gratitude. And then when you're ready, you can open your eyes.
So good. So good.
Thank you.
That's powerful. Yeah. Like,
Can I say something about
yes,
that,
please
too,
do.
while you're getting your thoughts? And this is more of a sidebar. And women who meditate have better orgasms.
Oh, hello.
Why? Because we're so busy
Yeah.
thinking about what our kids are doing for lunch, or younger kids' play dates, and what's for dinner, and what we're going to do next weekend, all while we're in bed trying to be intimate.
Yeah.
Well,
Ridiculous.
if we can draw in our energy and focus on our pelvic bowl, then we have the ability to just, be in our body. And then you're bringing more blood flow. Well, what do we need in order to have a good orgasm is good blood flow, right? Men do it real well, right?
Yeah.
They've got that one track down, which is a superpower, and I don't want to take that away from them.
No, not at all.
And just saying to women, let's have a moment to think about our pelvic bowl. And Dr. Meghan does an amazing job with giving her patients simple meditations to do after they come see her for holistic pelvic care. And so they have something they can take home and practice on a regular basis. It's so powerful. It's really, really powerful.
That's huge.
And I think a lot of people. I have a certificate in mindfulness and teaching mindfulness, and part of this 2-year training I went through really was talking about kind of the squirrel mind, the monkey mind, and how do we control it. And it's really not about that. And I think there's a little bit of a misnomer there that we can't think of anything, and really it's not about not thinking of nothing. It's actually trying to think of one thing, and really for this particular case, really focusing on the pelvic bowl. And if you notice that your mind starts to wander to what's for breakfast, or what's happening on the play date, or what's the emotion of my teenager and what they're going through, you notice it and you name it and you just come back. So it's not I can't do it. It's a practice. It's a practice for a reason, because we're all practicing, and it's just being kind to yourself while you're doing it, and recognizing. And the more we recognize and the more we practice, the better we get at it.
So amazing.
Yeah.
Because it is. I think that is a huge struggle. Like you said in the meditation, I know when you said, recognizing your pain, and just like that connection. Well, how many times are we not recognizing our pleasure for the same reason? Because we're not breathing into it, and we're not putting the focus where it needs to be. And
we're wired for survival, just to kind of like piggyback on that thought, is we're wired for survival. And so when we're wired for survival, we're not wired for relaxation. If we were, we wouldn't have a human race, right?
Yep.
So we have to work every single day. Our survival is important, but we have houses, we have doors we can, most of us can close and, keep out, what the danger.
Yep.
But we have to practice. And if we practice 1 minute, 5 minutes, 30 seconds, 15, it all counts. And it can be on a walk. It can be noticing your breath on a walk. It can be noticing the leaves. It can be noticing how your body feels. It's literally just taking a moment to be in your body. And women are so out of our body most of the time.
Always.
And this matters to our place of being grounded, and what we're doing for our own health.
So good. Well, and I like how you said to like allow yourself to have the thought, recognize it, and then come back to it. That's because I feel like, at least for me, in the moment, as soon as my head starts spiraling, then it's almost like this, like, now I'm spiraling because I'm spiraling. Now it's like, oh, well, now
I'm not doing it right.
You're right. It's like, oh my gosh.
Gotta get it right.
Yeah,
And
now I'm worried about that, rather than like, just like, okay, let it be. I went there, and now we're bringing it back and having that be okay. Because I think there's a lot of personal pressure, that we put on ourselves, that then it's like, oh, okay, well, now let's just hurry up and get this over with, because nothing's happening for me. So, instead just letting it go and coming back. I love that, because
well, and I think that gets into like this perfectionistness that we all kind of harbor. And I say that to patients all the time. It's like, you don't have to do the perfect amount of exercise or get the perfect heart rate during exercise. Like, even if you're just stretching at the end of the day for 5 minutes, like, that's better than not doing it. Like, we're getting in our own way of.
Yep.
little successes
Well,
because we're
yeah.
not doing it what we
'Cause
like.
it's like, oh, I didn't meet the goal, so
Yeah.
then I'll just give up on the goal because
Right.
what's the point? I didn't do it.
Right.
And I want you just to, when you're like this, and we get worried, or just like, this, where is our breath?
Yeah.
Where is our
Mhm.
tightness in our pelvic bowl? Can you feel it?
Yeah.
And then if you just kind of sink and you breathe into your belly, can you feel your grounded pelvic bowl? I mean, it's as
Yeah.
simple as that, where we go like this, or we go like this, and
It's like such a release of just like, oh,
Yeah.
okay.
and I'd love
Everything's gonna be
to
okay.
talk about what's happening muscularly.
Yeah, yeah, please do.
Can I do that?
Yeah, I would love
don't
to.
wanna-
No, I love it because that's, I mean, like I said, these are things that I think a lot of us just don't think about. Like
Yeah.
just even barely getting into it when you were like, okay, grounded, feeling your roots. It was like, oh, which is crazy to me because that's what holds us up. So like, how is it that I've never in 41 years thought about what's holding me up and what's going on? It's just through the motions. So yes,
Yeah.
please.
Well, so, just one more little tidbit about the breath, right? When we're breathing right here,
Yeah.
we're in fight or flight. When we're breathing in our belly, we're in rest and digest. So sympathetic overdrive or parasympathetic rest and digest, relax, right? So what's happening with our pelvic floor muscles, right? We have these muscles in the pelvic bowl here. And so we always think about the pelvic bowl as like probably the vagina, the clitoris, the vulva, the labia, right?
Yeah.
And a lot of our movements through space really are dependent upon the balance of the pelvic floor muscles. So we have this muscle that surrounds the anus. That's this hole right here, right? So we've got the anus, we've got the vagina, and then we've got the urethra up here, and then the clitoris right there. And so we've got this levator ani muscle.
And that's one whole muscle, right?
See how,
that's huge.
See how that muscle wraps around?
Yeah.
And then it comes right up by the urethra.
Yeah.
But that muscle where it extends up by the urethra, not as big as the muscle and the connection around the rectum and to the tailbone.
Right.
Right? So when we are stressed, we're breathing up here.
Yeah.
What happens to our rectum?
Oh, right.
It elevates. The levator ani muscle. Elevator ani muscle goes up.
Okay.
Oh, so then if you've got a trigger point, say you've got one of these bad daddies in your shoulder, you probably also have one right here, right? Because this is our stress point.
Yeah.
And so we're going to get trigger points down here. Well, so if you've got a trigger point, for instance, in this, say this levator ani muscle, here's your rectum, here's your vagina, and here's the levator ani muscle is my hand, and you got a trigger point right here. When we activate that, because we are stressed, or we're about to sneeze, or we're going to jump on a trampoline, we're going to activate it, and this muscle is going to go like this, leaving behind the urethra, and then you're going to pee, right? Then you're going to dribble because these muscles are so tight. So then what we do is we, with the pelvic floor physical therapy, we'll analyze, we insert one finger into the vagina, the patient will squeeze, and we'll assess how that balances around all the quadrants. And most of the time when somebody has incontinence, it does this when we're assessing. And they have no ability to close off around the urethra. Not rocket science. It is anatomy. Do we need to get a bladder surgery for it? No. We need to have some trigger point therapy in these muscles. So we assess all four quadrants, having the patient squeeze, like you might know about a Kegel. Right? So most people don't know how to do Kegels correctly. We'll talk about that.
Yeah, that's literally where my brain is going. I'm like, yeah.
So if we're sitting in the car doing Kegels and we're doing this,
right,
we're strengthening
yeah,
that,
but not the top,
right, to do that. So we have to relax these muscles so that, and when we do, the majority, if not all the time, unless somebody is so tight and so tense that they cannot relax, and that's another thing we'll talk about. But the majority of the time, we get a good closure after just 15 minutes of
so crazy.
gentle pressure, breathing in there. So we've got this levator ani muscle that is so directly connected to our breath and our stress.
That is
And
crazy.
so, you know, we've got other things we can do in the clinic to help people with stress and sleep and insomnia and all those reasons why we might be not able to breathe into our body.
Yeah.
But we also, you know, have the piriformis in here. You know, the piriformis that if you've ever had a massage therapist work on your piriformis, no?
No.
Well, the piriformis, the only way they can do that is, well, this is our glute right here. And then they usually put their elbow right in this little central spot right here.
Oh, yeah.
Right?
Yep.
That's trying to
I just have to do it to myself. I'm single.
Yeah.
So I'm just like, oh my gosh.
Well,
What's going on?
You don't have
The
to,
knots.
right?
I
Well,
know.
and, you know, tennis ball or racquetball or whatever that you're sitting on, you know, in the car trying to get that so that you don't get sciatica or, you know, so a lot of people with sciatica pain, we can get to the piriformis internally, right? And so it's about this far of a finger and off to the side, and we can really create some relief. So people who, pregnant women really have a big, because they, you know, they can't lay on their belly, they can't get the elbow in there. But we can really get to that piriformis. Can't tell you how many people do amazing with that. And then all these muscles, right? We've got an obturator internalis that opens and closes our legs, and so these muscles connect to our femur bone, and so any dysfunction that we have in the leg, the hamstring, the quads, we can often get at with what we're doing pelvic floor therapy wise. And then, you know, when people come into the clinic, because it's really hard to get your own finger, you can do your thumb, you can release your own levator ani, you know, at 5 o'clock and 7 o'clock. If this is your urethra is at 12 o'clock and your rectum's at 12 o'clock, here's your vagina, you can go at 5 and 7 and create some pressure, because that levator ani trigger point is
it's just right there.
It's right there.
Oh, okay.
But we teach people how to use this amazing tool to actually, you can use this on the levator ani and it just kind of create, you know, not going in this far, right?
Yeah.
Just this far, but also you can get at that piriformis and do some C strokes like this that really create so much relief and give you the power to, you know, take care of your own pain at home.
Insane that that's not talked about. Because I had no idea. Like, I had literally no clue that you could deal with anything back butt, anything related internally like that. Like, it's like...
So much tailbone pain. Like I had a fall playing soccer about 5 or 6 years ago, and my own teammate took me out. My last time I'll ever play co-ed soccer.
Oh my goodness.
He wanted the ball more than he wanted me to have the ball. but I cannot tell you how much that, you know, tailbone pain hurts, and to sit and get that relief, right? Because that tailbone is right there, connected to those muscles. And so,
well, and I just think like if you have pain there and then everything's tightening up and and then the like snowball effect of what all of that is creating, looking at that visually and how interconnected everything is.
It's
that's
so
crazy to me.
Nailed it.
I just, and like the Kegels.
Oh, you want to talk about Kegels?
Yes, because that just
Let's talk about Kegels.
Visually, that made so much sense to me though, because like when I think about Kegels, it's like, okay, you just, all I know is like, okay, you just squeeze.
Do 100.
Yeah, you just squeeze.
Yeah.
But to know that you could A, be doing it wrong, and then B, be tightening the wrong muscles, or now you're creating like the way you were like that, you know, now these can't, that's wild. So please
the way
share,
I teach people, and Dr. Meghan, you can jump in too, but the way I teach people is I have them do them when they're on the toilet.
Oh, okay.
And because right? What we're really trying to do with Kegels is we're trying to close that urethra off, right? We
Right.
don't want to pee on yourself. That's really the benefit. I mean,
Yeah.
there's other, for tightening the pelvic bowl or pelvic floor or vaginal tissue, but I'm going to say 90% of
Yeah.
women
Oh, yeah.
are hypertonic,
Mm.
or
So
maybe
too
one
tight?
side they're
Yeah.
too tight. And so if
Okay.
you're too tight,
Yeah.
can you squeeze?
Right.
No,
No.
we got to relax the muscles so that we can have a good squeeze in order to get the pee to stop. And
Yeah.
so first off, we need to assess, and we can tell by how the muscle. I mean, if I can feel somebody's bones while I'm pressing,
Mhm.
then they are hypotonic or they don't have enough muscle tone.
Yeah.
But the majority of women have that real tight levator ani because we're running around super stressed, right?
Right.
So we are working out all the time, and we're this tight.
Yeah.
And so anyway,
And then any little extra stress, like a sneeze, you can't squeeze any further.
Right. That makes so much sense.
Yeah.
Like, I was...
Yeah.
so we're going to work on relaxation to create strength. But then
Yeah.
in regards to Kegels, sitting on the toilet, what I like people to do is, they are peeing, you got to pee, you cannot close off a pee once you're sitting down, right?
Right.
But when you get to a point, maybe 2/3 of the way through your pee, and you feel like you can try and do a quick squeeze, that's going to give you the mental space of where you're supposed to be squeezing, right?
Oh.
And then we want to just release, push out, right?
Yeah.
Because we want to try and relax that. And then we try, once we're just dribbling, try and do a 5-second squeeze, like we're just drawing up for 5 seconds, and then we release for 5 seconds. And then once all that rest of that pee is out, then we do one more quick squeeze and release.
And that's, you just need to do that,
Twice
like,
a day.
not
Once or
this
twice a day.
doing 500
No,
throughout the
500.
day.
Please no
Like, it's
500,
so
because
crazy
we're
to
just
me.
doing
Yeah.
this. But I think you do take another take on that, or do a little bit more with that. Yeah.
Similar. I often talk to people about, like, we want the muscles to come in to center and
Mhm.
lift is like the movement that we're going for. So if you picture like picking up a marble with your vagina, it's
Yeah.
kind of what we're trying to do. Because I think sometimes we're just focused on like squeezing in, and we're
Yep.
not recognizing that
Yeah.
lift
The
part.
like the upper,
Yeah.
like draw
Yeah.
up
Yeah.
of it.
And
And
then
that's
we
it.
can do that kind of like elevator Kegel of like
Mhm.
breathing up and up and up, and then down and down and down, instead of like just a quick
Yeah.
nothing's happening squeeze
Right.
Yeah.
situation.
That's magical,
Yeah.
honestly, because I'm a visual, like, I doer,
Yeah.
right? So the idea of being able to do it while you're peeing, and you already know that, then you can duplicate that feeling, it's like, oh, okay, this is what I need to be doing, rather than just like, oh yeah, okay, I'm just gonna squeeze away.
Right.
And realistically, you're making more
Yeah.
issues. It's just crazy.
Yeah.
Yeah.
Absolutely.
Oh
Yeah.
my
Yeah.
gosh.
Yeah. The misinformation is a lot. And I would say too, some of the things I've noticed as well if I'm working with somebody with pelvic floor imbalance or hypertonicity, sometimes I don't have them do Kegels
Mhm.
because they, at the end of a treatment session, when I ask them to squeeze again so I can see how the balance is created,
Yeah.
they'll squeeze, but then it won't let go.
Yeah.
It just stays tight. And so there's a lot of work, and Dr. Meghan and myself work, and Dr. Sumner, who also does pelvic floor therapy in our clinic, work really closely together. So if somebody's really clenched and they, and we've done all this great work for relaxation,
Yeah. Oh my
and then they
gosh.
stay tight, right? Because that's the cellular memory, that's a muscular memory, that's what protects them.
Right. It just
Then
goes
they
right
go
back
right
to it.
her, and they work right. They work
Yeah.
on that mind-body connection, trying to release some of the trauma. We're very resourced. We really support people
Mhm.
in that. We really want to make sure people have resources, because there is a lot of trauma, whether it's from the media or an actual assault or a miscarriage or
Yeah,
a difficult delivery, or there's so many
Yeah.
things
Absolutely.
things that women hold in their pelvic bowl. So we are very conscientious in practice.
Mhm.
I love it. And I love that you have all of that, that you can source to each other to work together rather than like we were talking about it earlier before we started this, like just throwing a medication at it or just one and done, fix it all. It's like, no, this is a whole system of balancing all of the things.
Right. Yeah.
So what reasons or symptoms typically come up for people that would bring them to a pelvic floor therapist? Because I feel like when I started looking at it, like I said, there were so many things that I just thought were something I had to deal with or were normal. I think it would be great to kind of go over some of those things that most of us
I think
might not be aware of.
Number one thing that brings most people in is incontinence. Or leaking. So like your example of like jumping on a trampoline or sneezing and like you just leaking, but also sometimes just leaking without the stressor.
Just living. I'm just living.
Laughing.
God forbid. That's probably the number one. I would say pain is a good one that brings people in, whether that's really painful periods or pain during sex or pain once you're postmenopausal, and the hormone influence on the tissue creates like, thinner tissue basically is what happens. And that can then create painful sexual contact, but also sometimes just outside of sexual contact there can be pain and discomfort.
Just living.
Sciatica, for instance.
Right.
Or hamstring pain.
Hamstring pain and going through the pelvis to fix it.
Well, because the insertions, the original insertions of the what creates the pelvis, the ability to move our leg in space is because we've got a muscle group here that connects to inside the pelvic bowl, right? Or out here on the hip, or internal femur, external, on the sides of the outside of the femur. So hip pain. Huge. People have tight
and low back.
Low back pain. I mean,
oh my gosh, I need to come see you guys for all the things. I'm serious. I'm like the queen of like when you're like, I'm telling you, like I'm trying to use my knuckle and it's like all lower back and
Yeah.
And then I feel like a little less common things would be like vaginismus, if people are unable to relax those muscles and have penetrative sex. Or even insert tampons or things like that. Also, lichen sclerosis or other kind of skin conditions where we're not getting the circulation and the blood flow to those tissues. And scars like after surgeries and things like that. Dr. Sumner, who also does PT in our office, does some uterine massage, so external like lower belly stuff that can be great if you've had a C-section or cyst surgery or things like that too.
And people who are struggling with fertility and they, like just again, we got to create a space for a baby to want to be there. And if we've got trauma from like a previous miscarriage or a previous difficult birth or other trauma that just disengages us so we don't have good blood flow down there is really important. And I'd say chronic infections also really an important thing to know about, and hemorrhoids. That levator ani muscle that gets so tight, then I've seen great results with women with hemorrhoids and being able to relax that tissue, relax that levator ani muscle so that they're not like squeezing the hemorrhoid out.
So many
things. I'm sure we're missing.
So crazy.
I'm sure.
Well, okay, so I made a note because I wanted to ask, because I do think that I saw this on the website and I just want to know how. So men come in and see you guys, right? What kind of things do they deal with or that would trigger them to be coming in?
So we don't do men's pelvic floor work, just to like be clear about that. Okay. There are people who do.
Oh, okay.
We are not trained in
Got
doing
it.
that. But in my practice, most of the men that come to see me are partners or husbands of my patients, I would say. Once in a while, I'll have a man come in on his own. Um, and usually kind of the same things like fatigue, anxiety, hormone imbalance,
digestive dysfunction.
Yeah.
Got it.
Yeah.
Got it.
But, you know, it's really nice to treat partners of patients because when everybody's on the same page about
what's going on,
what's the best in regards to foods that are going to be anti-inflammatory, you know, sleep hygiene, all that kind of stuff.
To be able to support them.
Support each other on that is really a valuable tool.
Huge.
Yeah.
Okay.
And we do have referrals for men who do have pelvic floor issues. For other providers.
Gotcha.
Yeah.
Okay, so let's talk about the deep tissue and the holistic pelvic care that you guys do with the tools that you use. I know that you brought the what's it called?
The Thermiva.
Thermiva, thank you.
And the
Sorry.
MLT.
Yeah. Can we talk about that stuff and how that works?
I'll start with the devices. So the Thermiva, this is the instrument that we use. It uses radio frequency, which basically is heat. And similar to when you get ultrasound and they use gel, we use the transducer here at the end and gel internally. So you can do an internal and an external treatment. And you bring heat to the tissues to basically recruit collagen building. That's your body's response to the heat. It's so really helpful for incontinence, for if people are have had lots of babies and pregnancies and there's just like laxity to their tissues. It can help grade 1 and 2 prolapse. So if you have bladder or uterine or rectal prolapse often after having babies as well, it can help kind of strengthen the structural support for those organs internally in the vaginal canal.
That's so cool.
That treatment there's no downtime following the treatment itself. You can come in and go home the same night and have sex that night, or go about your day, go exercise, take a shower, like everything is pretty much the same. So we do treat internally in the vaginal canal, like top and bottom, and then externally on both sides of the labia and clitoral hood. You can also do like perineal if there's issues there. That treatment doesn't have any numbing cream or anything like that. You're in office. The total treatment time is usually about 30 minutes for that one.
That's not bad at all.
And then we do 3 treatments 4 weeks apart.
Okay.
And that's when we see the most benefit is when we hit those intervals. And then you do like 1 a year maintenance kind of treatment.
So rad.
People also talked about like their libido going up with that, especially with, you know, like women who are postmenopausal. Sometimes the tissue around the clitoris is, you know, thins a little bit. And again, bringing blood flow to that area really does enhance the sexual experience.
Make a huge difference, I bet.
And it helps with lubrication in the vaginal canal too.
Okay. And this is the one that is good for people who don't want to do hormone treatments in order to boost that collagen, right? I'm trying to put
they both are. Both of them. So this one we think of a little bit more, I tend to think of it a little bit more in like maybe the little younger crowd and people who have a little bit more thinner muscles or like weaker muscles, and we want to help like support all that building.
Got it.
We have also used this in conjunction with the other device, which I can chat about in a minute. And we've also used this in people maybe who can't tolerate the other device, because I'll show you that one next. It's a little bigger. So this is the internal probe. Excuse me. It's a CO2 laser. So this gets attached to the laser, and then there's a mirror on the end that reflects, so nothing's going to hit like cervix or anything like that. The big difference, obviously, the size difference is one piece of it.
Yes, ma'am.
Yep.
And this uses gel.
Yeah.
Oh, right.
This
That's what you're saying.
has
and
to
this
go in
one...
dry because it'll interfere with the firing of the laser.
Oh.
So you can't come and receive this treatment if you're on your period or things like that.
Got
too.
it.
So for some people who are maybe 5 or 10 years postmenopausal and they have had that atrophy and that like shrinking of the tissue, this, while would be the better choice treatment wise, they might not be able to tolerate that at first. So we'll start building some of that elasticity by doing a couple of those treatments until we get a little more comfort.
Baby step into...
Yeah, and then this, we do use numbing cream externally on the tissue. It wears off within a few hours. It's not, you're not like going to the dentist. You're not going to be numb all day.
Good to know.
And same thing, we do an internal treatment with this probe and then external with this one. And this is just so we get the right distance from the tissue for the laser to fire. That treatment in office is a lot quicker. It's like maybe 15 minutes at the most. But we can treat a lot of the same areas. Obviously internally, external labia, we can treat the perineum and the introitus, which is just the vaginal opening. What we can't treat with the laser is clitoral hood. So if people are having decreased sensation or arousal issues or things like that, we will do the two treatments together. So we can use this for the deeper tissue collagen recruitment and then use this just over clitoral hood to help circulation and collagen building there.
Magical tools.
Yeah. And in combination with hormones, in combination with the pelvic floor work that we've already talked about, it really, really makes a huge difference in people's lives.
And are these things that, treatments that could be, that people could do early on to be like preventative to losing collagen? Or are these things that you would typically, that would be better for people who are already in that spot?
Yeah. Both of these devices come from the aesthetic world, which, when we first brought it on was a lot of what we had to navigate because that's obviously not where we're coming from. We're not trying to like create a certain appearance with labial tissue or a certain size of vaginal
Trying to make
opening.
a pretty kitty.
Yeah, exactly.
And if you want, okay.
Well, for sure.
Right. That's totally your prerogative, but it was really hard for us as naturopaths. We're really trying to treat the whole person.
Right.
To like, how do we get on board? Because that doesn't feel like that's why we
where
brought
you're
it
at.
on.
Yeah.
Right? We really brought it on as a non-hormonal option to help women get intimacy back with their partners after going through a cancer treatment, right?
Yeah.
So, and then, providing for other people, but anyway, sorry.
But, no, that's okay. Yeah, so that, so you can come at whenever you want, basically, as long as you meet certain qualifications that we do a free 20-minute-ish consult that will run through like your PAP history, what your complaints are, make sure there's certain things that you don't have going on, like an infection or on blood thinners or things that would stop like the healing process. So we just kind of run through a questionnaire and interview, and then based on that, we would decide which treatment makes the most sense with where people are at.
Cool. I don't know. I like 20 years ago, I feel like I should have been like doing some things, like
well, certainly the pelvic floor therapy is the place to start, when you're at any point. And, we will sometimes even suggest some of these, the Thermiva and the MLT for women who have a lot of hypertonicity that aren't responding. And if we've been seeing them for 6 months and they're not, and
Right,
they're not
seeing
making
differences.
progress with that, and maybe they haven't had a baby, and maybe they, they're still in their 30s, but there's something else going on
Yeah.
that
Yeah.
they also can break the cycle and
Right.
support with that. So, we're the cool thing about being a naturopathic physician is we can just really like meet you where you're at and kind of think a little bit outside the box and kind of think about how it will most benefit you, what treatments will most benefit you that we can offer.
So amazing.
Yeah.
Well, and like we were the steps, the many things that lead to the issue that I come to you with, how do we treat those other things so that it doesn't, because I know for me, it's like, oh, okay, I have a yeast infection, so let me take these antibiotics, and then I am so salty when it turns around and comes back. And now it almost is worse. And now the antibiotics don't want to work and all these things. And it's like, oh, well, I have quite the addiction to sugar. And that probably could have helped the situation a long time ago. Like, I love that there are so many avenues of fixing the problems with you guys rather than just like, oh, okay, here's your one and done.
Well, you're not alone, my dear. You're not alone.
Goodness.
Even taking that example is, like, what are all the different things that are going into that for you?
Right.
And, okay, you're addicted to sugar. Well, is that sugar, or is that you being tired and doing too much, and that's the quickest fuel for your brain? And so do we need to sleep more? Do we need to support your adrenals? Do we, is there a yeast, a yeast overgrowth, not just in your vagina, but is it in your digestive tract?
Right.
And that one pill of fluconazole, the antifungal they give you to clear it, clears maybe 80%. And so now we're creating some resistance because the other 20%, you don't have symptoms anymore until you eat it again. And and by the way, when you're stressed, we release more glucose from your stores, and so then we're getting more glucose in your system. And so there is,
I'm like, I'm melting.
We might have to do a GI map. We might have to see what's going on in your, your whole system.
Yeah.
We might want to do an adrenal test to see what's happening with your cortisol, your circadian rhythm, what's happening with your sleep. We might want to eat more protein. We might want to eat more fat. So we're feeling more satiated and reducing the need for sugar. Like, there are so many things that go into you having recurrent yeast infections. And of course we could do pelvic floor work too.
Right. Because if we're breathing in, if we're breathing, then it's, I'm just.
Oh, and, there are also more. I was speaking with a scientist yesterday about a test that they're starting to work on, and I'm not going to say anything about it yet because it's still in the works, but on really like identifying all the flora of the microbiome of the vagina. Like, we treat BV and we treat yeast with 2 medications, but are there other bacteria when we still have those symptoms? And so I'm super excited about this time that we're in because there's a lot more female scientists that are really excited about doing work in women's health. And, we talk about hormones a lot with patients and the risks that there are with some of the hormones and also the benefits, right? Because we have to weigh that.
Yeah.
But we don't have enough long-term studies. We did one big study back in the 90s or early 2000s, a Women's Health Initiative, and we didn't get enough information. But that was like the last big study. And so, I mean, we still don't know all the answers of what's going to happen if we do all these things. So we want to be really judicious, and I'm really frustrated with a lot of colleagues in not only the naturopathic world, but the allopathic medical doctors, nurse practitioners who are prescribing hormones without, and you can even get them online now, which is absolutely insane, but it's not okay. Because it's not safe. We got to do testing. We got to really make sure history is there. And anyway, I'm a little bit passionate about that.
Well,
Did I stop smiling?
I'm with you though, because it feels like at my age now, there's so much, the few conversations that are being had are typically, oh, I need to get on hormones. Oh, because I feel like I think about my mom back in the day, and there was no conversation about perimenopause. So now that that's like starting to be talked about more, which I'm really grateful, because I'm pretty sure I'm right smack in the middle of it and I have no clue what's going on. But the hormone situation, it's like, are, isn't half of our problems, not half, but you know what I mean, a lot of problems caused by a hormonal imbalance. So then you're just taking more, and it just feels willy-nilly. It feels like, oh, like it's a catch-all, like, oh, just take these and it'll make everything better.
Easy.
That's exactly what I was going to say.
Yeah.
It's the easy solution that people will feel better while they're on hormones, but it's not fixing the problem. And it's not looking at, we talk a lot about, and we brought our fun little diagram, but like we talk a lot about how the endocrine systems are all connected. So if we just focus in on estrogen and progesterone, we're missing your thyroid, we're missing your cortisol, we're missing your aldosterone, or like there's just so much more that we can dig into and look at. And getting back to like the nervous system influence, like maybe you're burning out and you're getting into fight or flight, and you're running on adrenaline all the time, and maybe your liver needs support and you're just recycling all your estrogen. Like there's just so many layers of it that we can look at. I just had a patient the other day that was like, all my girlfriends are talking about hormones, and I'm in my 40s and blah, blah, blah. And like, I was like, great, let's do some tests. And we are testing all three of those endocrine systems to see where the imbalance is. And sometimes it's all three. But if you only narrow in on one piece, you're missing so much more.
Not fixing the problem.
Yeah. And why people feel so terrible perimenopausally, because, up until that point, right, you really haven't been paying attention to your body, right? You're just going, and you're doing all the things, and then all of a sudden your estrogen does this, and then it does this. It goes up and it goes down, and you're doing this like up and down, up and down, up and down, up and down. Well, that's happening to everybody, all women in the perimenopausal years, because we don't know when our ovaries are going to release those hormones and when they're not, and so if you don't have reserves, if you don't have adrenal reserves, then you're going to feel the high and the low, and that's where you're feeling those hot flashes and the night sweats. And then you're getting into, not sleeping well. And then you're not sleeping well, and then your cortisol doesn't get replenished, because that's where we replenish our cortisol. And so then if we don't have good adrenal status, then we're going to keep needing more and more and more hormones. And then, well, getting to the source, let's go back to the adrenals. Let's get you sleeping. We've got herbs we can do. We've got, other, maca is a really great herb formula that we can identify for pre, peri, and postmenopausal. But there's a lot of things we can do adrenal wise to support. And so that's where I always start with somebody who's having hot flashes and night sweats, because it's given me a clue that they have lost their bandwidth. They have lost the buffering system to support their hormones. And so we might do hormones, and more isn't necessarily better. More can create more risk factors.
Gotcha.
And don't get me wrong, like hormones and brain cognition, there's some really great studies on that. And people have a big fear of dementia and Alzheimer's, and they're losing their mind in menopause. Well, they're probably losing their mind because they have no bandwidth.
Right, you haven't slept, like you said,
they're not sleeping. And so, or the ADD mind that's getting all the hubbub right now in peri and menopausal women. And I think there's a combination that's going on, and part of it is we have just been multitasking so much and not doing any self-care for so long that then we've lost that ability. And then again, this like this high and low of hormones that constantly is driving us
out of whack.
And then like Dr. Meghan mentioned aldosterone, and I don't know if you know what aldosterone is, but it's
No.
the blood pressure regulating hormone.
Oh, okay.
And so in this fancy metabolic hormone chart, we've got cholesterol up here. This is the backbone of all of our hormones. So every hormone's based on cholesterol. And that will be a segment, another segment on cholesterol. And,
Oh, good, because I just found out mine's high too,
Oh,
so
geez.
I need y'all for
We'll
everything.
get there.
And so we've got kind of two sides of the pathway, but this side I think is really, really powerful. It goes into progesterone here, right? Progesterone feeds into the cortisol pathway. So a lot of women will complain of pain, right? In perimenopause, menopause. Well, if what happens in menopause and perimenopause is we stop ovulating so much, right?
Yeah.
And when we ovulate, that's when we are producing our progesterone, right? So the shell that the egg pops out of is what creates the progesterone for the second half of the cycle. And so when we're not ovulating, then we don't have that big bolus of progesterone, right? And so then if our cortisol is depleted, then we're not going to make the steroid to stop our inflammation, because if we need to run from the tiger, because we're still running from that tiger with where we're breathing, well, full circle back to that.
Yeah.
Right. So we've got this progesterone pathway that's really important, but also if we are depleted here in this cortisol, this progesterone, and we make progesterone in our adrenals. Men make progesterone as well, but women catch up to men postmenopausal with all the cardiovascular risk factors, because now we're making the same amount, because prior to that, in our premenopausal years, we are making it, if we're not on birth control, we're making it through ovulation, right? And so this pathway over here, this is aldosterone, our blood pressure regulating hormone. So blood pressure starts to spike, right? Or when we're stressed and we're not sleeping, our blood pressure spikes, right? Because more of this is coming down this pathway. Right?
Oh my gosh.
And then we've got our estrogens over here and our DHEA. So our cortisol and our DHEA are big adrenal hormones that we can specifically support. You don't want to take You could get DHEA at the health food store, but you don't want to do that on your own, because it can drive up testosterone and it can drive up estrogen. So we want to be judicious about the use. We want to test before taking it. We want to know what's happening.
Yeah, what we're doing.
Yeah, what we're doing.
Yeah.
I mean, I'm all for having access to things to help, but it is, I think there's something to be said for, like, there are experts who went to school or who did have this knowledge that, and the tests and the information before just going and just taking whatever, and like all the things you can get through the mail now. You can subscribe to this, that, and the other, and I'm like, that just seems like
Yeah, well, and I think that is driven by people going to the doctor and only, they're tired and they're getting a CBC and a metabolic panel. Great. Super important to know what your white blood cells and your red blood cells and your kidney and liver function are doing, but it's not testing the whole person, right?
The big
And so
picture.
people are frustrated. They know they don't feel good. They know they could feel better. But if you go to a naturopathic physician that's trained in a state that's licensable, right? Because
Go Oregon.
Go Oregon. We're now licensed in 25-ish states, and but in other states that are not licensed, then you can see maybe somebody who was not trained at and could not be licensable. So that's a little nuanced, but in Oregon you are good and you're set. Washington, California, Arizona for the West Coast, and then a variety of schools throughout the country, or variety of states throughout the country. But seeing a naturopathic physician is really a blessing, because we'll take time with you. Most of our appointments are an hour long, and
Hello. An hour?
An hour. Yeah. an hour long.
Yeah.
So it's a head to toe. Like we're
That's-
looking at a
And you get to get
system.
into
A
it.
game changer.
Yeah.
Right. Systems of what's happening with your body. We can draw connections because we have time to draw connections, and you
Yeah.
can share your story.
Yeah.
And you're the most knowledgeable about your own body,
Right.
right? I have the information, and I can ask you questions, but I have to have the time to really do that, and then I have the
Right.
opportunity to order all the tests that make sense instead of 1, 2, 3, maybe
Yeah, your basic bullet points,
basic
then we're
bullet
moving
points.
on.
So
Oh
anyway,
my
that's
gosh.
a little plug for our colleagues in naturopathic medicine.
Yeah,
And
a huge plug because don't get me, I won't get started on healthcare and where I would love to see it go, but I think you guys are at the forefront of it. So that's amazing. Um, um, let's see. I'm hoping you guys will come back.
absolutely.
We'd love
Yeah,
to.
I'm just gonna ask you on camera
Yeah.
so that the pressure's on.
We'd love to. We have so much to share.
Because I still have so many things that I would love to go over. But I know our time is getting to wrap up points. I know you guys have patients today. So tell us about, before you go, your Galentines event that's coming up and because I think that sounds super fun and amazing. And anybody here in Portland should absolutely be there. And the nonprofit that you're working with, because I think we need to spread the word.
Yeah.
Sure. Yeah, this is our 4th year doing our Galentines event, which, if you don't know, officially Galentines is the day before Valentine's, thanks
So
to
good.
Parks and Rec. But it's really fun. We get all 4 of us doctors in our clinic have things that we're presenting on and talking on, but we also partner with other experts in areas of sexual health and pelvic health. We have a dietitian coming this year who's going to talk
nice.
about women's health and I think aphrodisiac foods. And yeah, it's just a really fun event with hors d'oeuvres and drinks, and you get to learn a little bit about your sexual health, your pelvic health, and intimacy. We also have a raffle that we do. So some local businesses, as well as some of the presenters, have all donated services and goods to the raffle that we do at the end of the night. And you'll go home with a little goodie bag with samples.
I love
and
goodies.
all that kind of stuff.
Lots of goodies, lots of different lubes, and you'll make a libido tincture that's personalized.
You'll make it there?
Yeah, yeah.
Oh my
Yeah,
That's
we have
one of the little
shapes that
workshops.
we do, and then you can, depending
fun.
on your specific priority, you can add your personalized herbs to it. And there'll be sound healing session
Ooh, I love.
there. Yeah. So really cool presenters that we're excited to.
Well, I'll make sure we put it on our social media.
Great.
So that people can get tickets, because it's a ticketed event, right?
Yeah, it's a ticketed
Okay,
event.
cool.
It's $25. All the money goes towards the foundation that we've started called the Center for Courageous Health. This has been my dream to do for people with women with cancer, and so providing resources for underserved communities who have not had access to naturopathic care and integrative oncology support. And so it's a big need. It's not cheap. None of the things we do are covered by insurance. I'm covered if I'm on your panel, but in my time, but none of the other things that we could do to support women and helping their body and cells stay healthy, the good ones, while we're also addressing, the cancer cells through chemo, radiation, surgery, pre and post, and all that kind of stuff. So I'm really excited. The IRS approved us at the end of the year, and we are starting full steam ahead. Yeah.
So good.
Yeah.
So good. Well, we'll put that out there too, so that people have that knowledge, because I think helping people who don't have the access to it is absolutely amazing, because it is something that everyone should I feel like it should be the first step, not the last step. So thank you guys so much for
Thanks for
being here with
having
us
us.
today. And I am going to hold you to it because I can't wait for you guys to come back.
Okay. We
Thank
love
you.
too.
Yeah.
Thank you
Sweet.
so much. Congratulations to you too.
Thank you. Okay, well, Lisa, Megan, I want to thank you guys again for hanging out with us today. So much good information, so many things that our community needs to have access to. So, with that being said, what's the best way that our followers can reach out, find you, locate your services?
Our website, amberwellnessgroup.com, is going to have all the resources for scheduling an appointment, has our phone number, address, and then a lot of the resources that we discussed today, and videos, how-to things at home are on there as well. Yeah.
Cool.
Website.
And then you're on social media. We'll put that up for people to find. And then the Galentines Day Event, we will make sure that we post that as well so people can find you guys
Coming
there.
up.
Awesome.
Sweet.
February 13th, mark your calendar.
Yes.
Join us.
Awesome. Yay. Well, I can't wait to have you guys back. So many more things to go over, to learn about. And yeah, thanks for being my first guest.
Thanks for having us.
Thanks for having
Thank
us.
you.
You did great.
Thank you. You guys did too.